Hi everyone, I'm Bonnie Coyle, Public Health Director for Cabarrus Health Alliance. Today is May 21st and I'm here with the COVID-19 update. Our case count as of today is 425 cases. We've had 22 deaths and 270 recovered. That leaves us with 133 active cases in Cabarrus County. We will be bringing you each Wednesday data updates that you can then access anytime on our website. Due to the governor's briefing yesterday, we weren't able to review the data, but we're going to take time today to walk you through that. You can access the data by coming to the cabarrushealth.org website and clicking on the banner right here. You then click on the Cabarrus County COVID-19 data, and that will bring you to the data that we are monitoring to determine if we have safety conditions to move forward with reopening for the county. So this first metric is looking at surveillance for COVID-like symptoms. So how many individuals are going to the emergency room with flu-like, COVID-like symptoms of cough, shortness of breath, fever, body aches and pains. And we are the pink line right here. We're in Region 7. And you will see that for quite a number of weeks, the symptoms surveillance has been declining. So we're going in the right direction for this particular metric. We go on to the next one. Here, this data will show you how many lab confirmed cases we've had over the past 14 days. It's important to look at new infections. Okay, this orange-red line shows you how many total cases we've had through the end of last week. And then the blue bars show you how many new cases we had each week. And so what you'll see is that cases have in general been steady, and we've had now 2 weeks of slightly lower numbers. So this metric is doing pretty well and going in the right direction. Our next measure is positive tests as a percentage of total tests over 14 days. Now this is an important test data to look at because it helps us understand whether or not we have a problem with the number of tests as our number of tests continue to increase. We want the percent positive to stay below 10%, so that as we're doing more tests, we're hoping that there are less amount of them that are positive. So if we keep below 10%, we can feel pretty good that we're testing enough people, and yet the rate of infection is staying low. And you can see that for the past 3 weeks, the data positives have stayed below the 10% mark. So this is another good metric for our county. It's also important to take a look at hospitalizations. We want to be sure that hospitals are not getting overwhelmed with the number of individuals who are infected. And so we want to see that rate continuing to drop and stay low. You'll see at our peak, we had 20 Cabarrus County residents hospitalized, but for the past 2 weeks, it has dropped substantially and we're down to only 4 and 5 people being in the hospital. So this metric is also doing well locally. For testing, one of the things we need to do as we're opening up is make sure we have a lot of testing available for individuals so that if they are having symptoms, they can get tested, we can identify who has a positive test, and we can work with them to have them go into quarantine or isolation. And as you can see here, our tests have been up around 500-600. They dropped off a little. We're having some difficulties now measuring this particular metric because the state has stopped providing county level information. However, we are working with our local entities that are providing tests to be able to collect that data, and we will hopefully have a better update for you next week. If you're interested in getting a test because you have symptoms or you know that you have been in contact with someone who's a positive case, you can see where you can go get testing by going back to our cabarrushealth.org page and clicking on the testing information tab. as we go back to finish up the data tables. That's, I think if we, here we go. Sorry about that little bit there. Okay. Workforce to conduct contact tracing. Here at Cabarrus Health Alliance, we have significantly large number of staff who can help with contact tracing, and we are meeting all of our requirements to get in touch with everyone who is either a positive case or who has been a contact to a positive case. So we're doing very well on having individuals who can do the contact tracing for us to make sure we do not allow spread of the disease. And our last metric that we are measuring is availability of personal protective equipment. We want to make sure we have enough supplies on hand to protect individuals, healthcare workers, frontline staff. And as you can see, we have either stable amounts of some of the protective equipment, or at times we're a little bit low, but we are working on this. We're making sure that supplies continue to be identified so that we can stay in a more stable environment. So if we go back to that page, what you'll see is we have color coded these with a traffic light type system, and you see here that of these 7 metrics that we are monitoring to make sure we are keeping the epidemic in control, 5 of our metrics are green and 2 are yellow, which means they're going in the right direction, but they're not exactly where we would like them to be. So we feel pretty good here in our county that we are monitoring very well and maintaining the epidemic under control, and that we're moving in the right direction on all these metrics. Again, this will be available and updated every Wednesday for everyone's ability to access. If you have any other COVID-19 related questions, you can email healthinfo@cabarrushealth.org, or you can call the Health Info line at 704-920-1213. Have a wonderful afternoon.